Thank you very much. Okay, can you hear me? Yes. Thank you very much for the nice introduction and also for the opportunity to speak here at this wonderful conference. As you might have gathered from the introduction, I am, in fact, a clinician. I'm a medical doctor. I have 15 years of experience in treating lifestyle disease. And during the past several years, I've gained an interest in nutrition. So now I'm also the manager of a digital health tech company where we help people improve their metabolic health by changing their eating habits. So today I'm invited to speak about dietary strategies in managing diabetes with a special focus on intermittent fasting, the ketogenic diet, and I'll also touch briefly upon how we can combine dietary strategies with GLP-1 therapy. So India is facing a huge health burden, as you probably already know. India has the world's second largest diabetes population, and with millions of adults getting diagnosed every year, and the number is just growing. Rapid urbanization combined with a dietary shift is causing obesity rates to rise, and obesity is a key driver to type 2 diabetes. The Indian diet, which I personally really love, but it is often really high in refined carbohydrates and unhealthy fats, and it's making glycemic control a challenge. So this calls for culturally appropriate and evidence-based dietary principles to meet these challenges. Because we all know here today that diet is a main component in the treatment of diabetes. And then what is intermittent fasting? And can this play a role in the treatment? Intermittent fasting is actually not about what you eat, but it's about when you eat. And this comes in many trending variations. One of the more popular ones is the one called 16-8. Here you eat in an open eating window of 8 hours. And during this time, you're actually allowed to eat whatever you like and the amounts that you like. And then for the remaining 16 hours of the day, you're fasting. And during this period, you cannot eat anything, of course, but you can also not drink any fluids that contains any calories. So only water, tea, and coffee without sugar or milk is allowed. Some studies show that this might lead to weight loss. It might help improve insulin sensitivity. And even some animal studies start to show that it can prolong life. Only animal studies so far. Actually, there are not so many RCT studies on this field. One of the more recent one is a Danish study. I was not involved in the study, but I would like to mention this study anyways, called the RESET study. The researchers wanted to examine if time-restricted eating of an hour of the open window of 10 hours could improve metabolic parameters in adults in the risk of type 2 diabetes. And this study was conducted after a really successful pilot study where they included 20 patients and found significant weight loss of 2 kilograms and an improvement in HbA1c of 4 millimole per mole over a period of only 12 weeks. So the researchers, they were really excited and hoped to, of course, recreate these nice results in the larger research study that included 100 patients. Unfortunately, this was not the case. They found no significant effect on weight loss. They found actually no significant effect on HbA1c when adjusted for multiplicity, and only really high adherers to the diet were able to achieve a significant weight loss of 1 kilogram during the period. And this was not considered clinically relevant. They did not give up. They continued their studies. So there's an ongoing study now called the RESET 2 study, where they're trying to see if they can adjust the time-restricted eating window to the individual lifestyle and see if that can create results. And it will, of course, be really exciting to follow. Now, the ketogenic diet. The ketogenic diet is a diet where you have a really low intake of carbohydrates and a higher intake of fat. A systematic review from Tinkerley et al. From 21 showed that this could in fact lead to a significant weight loss, a small improvement in HbA1c, and also a lower need of medication in type 2 diabetes patients. However, they also found, as we heard just earlier today, that it was really difficult to adhere to this diet in the long run because it's quite a restrictive diet. Also, there's some risk factors involved. And in my clinical practice, I've actually met a lot of patients who have had great success with really huge weight loss by following this diet. But unfortunately, I've also seen a lot of examples of skyrocketing lipid profiles on these patients. And that's really quite the dilemma when you're sitting in front of a patient as a clinician and you have to communicate the risk of cardiovascular disease versus a patient that's really happy because they lost a lot of weight. So what I've been doing for the past several years is helping patients implement our national dietary guidelines in a practical, simple way at home. What we do is that we teach the patients that they have to place their food on the plate by using their hands. So they should place 1 to 2 handfuls of fruits and greens, 1 handful of protein, and 1 handful of carbs, plus 1 to 3 tablespoons of fat. And that's the composition of one meal, and they should do that only 3 times a day. That actually gives a perfect balance both in the calorie intake, also in the macronutrients, and gives a daily energy consumption consisting approximately 40% from fat, 30% from carbohydrates, and 40% from protein. So that makes the diet really suitable also for diabetics. That's why we have an official collaboration with the Danish Diabetes Association where we help their members change their eating habits by using our method through our digital tool. I just brought one. We have a lot, but just one real-world example. This is Birgitte. Birgitte, she has type 1 diabetes. She was diagnosed when she was 11 years old and is, of course, receiving insulin treatment. After pregnancy and giving birth, she found herself heavily overweight, weighing more than 30 kilos too much. She started implementing the method, and by this, she lost 33 kilograms and was able to halve her insulin dose and avoid the surgery for retinopathy that she was about to undergo before changing her eating habits. For the past 7 years or so, we've been able to treat our type 2 diabetes patients with GLP-1 therapy in the form of Ozempic. And this is, as you probably already know here, is because that Ozempic has the ability to control the blood sugar by increasing the release of insulin from the pancreatic gland while slowing down the release of glucose from the liver. And we saw nice effects on our patients when we started using this, and also kind of a funny side effect because patients that were not able to lose weight for many, many years suddenly started to lose weight. So we thought, okay, something might be coming. And it did, because in the end of 2022, GLP-1 was also approved for the treatment of obesity. And now we're starting to see some data of patients who are using both the SENSE methodology and GLP-1 therapy in combination. This that you see on the screen, that's not a publication, but it's real-world retrospective data that we've taken from 4 patient cases. And as you can see, patients ID 1, 3, and 4, after 1 year of treatment, they have actually managed to lose 30% of their body weight using changing their diet and using GLP-1 therapy only in 1.7 milligrams, so not the maximum dose. The red line that you see on the screen, that's from the Novo Nordisk Step 4 study. They were also giving dietary intervention plus the maximum dose of Wegovy, which is 2.4 milligrams, and after 1 year, they achieved 50% weight loss. So this really shows that there's more to gain if we can really teach the patients to change their dietary habits. And this is on a lower dose of medication than actually recommended, plus the patients, they did not report any side effects, and they were changing their eating habits along the way. So GLP-1 therapy, it certainly has a lot of medical benefits. It can improve glycemic control, it can enhance weight loss, and now it also has the potential to reduce cardiovascular events. But it is so important. It is really, really, really important that we get all the dietitians also on the floor, because we need to help the patients change their eating habits, or else they will just regain the weight whenever they would go down in dose or stop on the medication. Also, protein is so extra important for these patients because they actually lose muscle mass at a more rapid pace than in a normal weight loss. So this is no news to you at all. When implementing a dietary strategy, we need to have the patient in focus. There's no one-size-fits-all strategy. We cannot tell a person that weighs 130 kilograms to go run 15 kilometers and also only eat 1,200 calories per day. That's just impossible. We need to make sure that they are rightly monitored, especially if the patient is receiving any kind of medications like antidiabetics, because for sure, when they start to lose weight, they will need to go down in dose. And lastly, but not least, we need to provide the best and most comprehensive educational and behavioral support to the patients. So I only have 4 key takeaways from my speak. 1, we definitely need more research on intermittent fasting and the ketogenic diet, both in terms of efficiency and long-term safety. Maybe the use of digital tools can help the compliance of the patient when you're changing habits. 3, there's no one-size-fits-all strategy. And 4, when implementing and using GLP-1 therapy, it's so important that you follow this by the right dietary strategy as well. And as I conclude, let me just want to emphasize the importance of collaborations. Doctors and dietitians and researchers, policymakers, and tech providers need to work together to ensure the best patient-centered care. And we have a small collaboration with Cordia 360 here in India, actually, where we're bringing clinicians closer to the patients through technology and helping the patients also change their eating habit through digital education. If you would like to learn more about this, please approach me after my session. I'll be happy to tell you more about this. And tomorrow, we're also hosting a small gathering where we'll tell you more about how you can use GLP-1 therapy and dietary intervention in your treatment. Thank you.